Hey guys, Ryan Carty here again. I'm out in Arizona with Prion disease. I just want to keep you guys updated on what's going on with me. I'm only able to eat about one meal a day. I mostly just drink fluids, non-stop thirsty. My skin is always just dehydrated and itchy and dry. Even going to the bathroom now. I'm having trouble holding my bowels and my bladder and everything. I have to run to the bathroom every time that I go. Some days I spend most of my days on the toilet because of this. Even when I go to the bathroom, it's severely abnormal looking. You could just tell it's very difficult for my, not to be disgusting, but very difficult for my stool to pass through my intestines. So that's pretty scary. Even when I eat something, you could just hear these crazy bowel sounds from it trying to digest the food and everything. It's just severely abnormal and not, it's not right. Definitely abnormal and out of the ordinary. I've been to an infectious disease doctor through Banner Health up in University of Arizona. I went to a dermatologist up there too because of the sores and lesions I have all over me from this, which I believing that this prion disease, this strain that I have, is probably most resembling scrapies because of the way my skin itches and the sores and lesions I have all over my body. So they told me there's nothing they can do. There's no help, no treatment, no cure, no anything. When I know for a fact that people that either have the disease or family members that may have a 50-50 chance of getting it passed on from their mother or father that have passed from prion disease, they get put on doxycycline for, I guess, the remainder of their lives to prevent it from them getting it and stuff like that and everything. So there is things that they can do, but obviously he said they don't do that there. I know there's experimental treatments and stuff too. He said we don't do that here either. It's the NIH that does that kind of stuff and everything. So it's just like, and I've been on doxycycline for the past about 3 months or whatever, and mirtazapine also, which is a tetracycline-based drug. They're both tetracycline-based drugs, and I believe the combination of those two have helped delay the progression of this disease greatly, which is why I'm still functioning, able to talk, walk, speak, everything at this moment in time and everything. So, but it is getting scary. I'm having more difficulty with sleeping. My sleep is still severely abnormal, and I can't seem to get any kind of rest. I always wake up just completely exhausted, tired and fatigued no matter how much I try to sleep. I wake up, I have the craziest vivid dreams. I wake up acting out my dreams. I've woken up having convulsions before and everything as well, almost like seizures in my sleep and stuff and everything. So I know they were also doing studies in the UK right now in regards to trazodone and I think it's a newer chemotherapy drug in regards to prion disease. Now, I know for a fact I was on trazodone for sleep, and I had the worst rebound effect from taking that, and I wake up in a brain fog from that stuff. It would take hours for me to come out of that, for it to wear off and stuff, and to feel somewhat normal again, and I actually felt like I came close to having a couple seizures while taking it, and seizures is a possible side effect from taking that drug and everything. So they said it's a possible treatment for it. So I tried it, and I have prion disease, and it didn't work too well for me. So I guess they'll see in their study and everything out there in the UK and Europe and everything. So it just amazes me the level of just negligence and just the misinformation and the uneducatedness of these medical facilities, University of Arizona, Dr. Craig Brown and his colleague or whatever, and some of these other places that just don't understand. They're not up to date with the most recent research in regards to all this, because yes, scrapies is now transmissible to humans, they're saying, and they're reinvestigating CJD cases of victims that have passed away to see if they possibly died from getting it from lamb, mutton, or, I guess, sheep on a farm or whatever, which I believe happened to me from out in New Zealand. That stuff came from out there, and sheep's very big importer out there. And now they're having a lot of CJD cases out there right now, and I'm wondering if it's because of the fact that they had scrapies very prevalent out there throughout all of their farms and everything. So as of right now, nobody's helping me and my kids and my family. I continue to get worse and worse. I could barely eat and keep